What's up? How we doing? How we doing? How we doing? We got sound. Looks good. I see sound. Got a mic check here. Good. Mic check there. It goes. What's up, guys? All right. Good evening, viewers. I'm Dr. Joaquin Acosta, your guide and ally on this ever-evolving world of pharmacy and wellness. Welcome to another enriching episode of Know Your Pharmacist, brought to you by Farm True, where we fuse cutting-edge science with the heart of community care. Tonight, we delve into the fascinating world of healthcare, exploring how pharmacists beyond any celebrity endorsement are the real champions in promoting vaccine awareness. Cough, cough, Travis Kelce. We're going to unravel the power of predictive analytics in healthcare, revolutionizing how we foresee and manage health risks. But that's not all in our Herbal Wellness Corner, sponsored by High Horse Cannabis Company. We'll explore the transformative journey of Rick Simpson Oil and give a good reminder of the testament to the healing power of nature guided by science. Going to give the full Rick Simpson Oil protocol there that our cancer patients are definitely considering at the very least, and we do have some people on it. Join us as we spotlight the inspiring initiatives in our communities, like the NMSU Astronomy Open House, where the stars aren't just in the sky, but also in the hearts of those dedicated to learning and exploration. Let's not forget our Men's Health Minute, sponsored by Botto Speedway Park. Here we're redefining men's health, focusing on holistic well-being, from testosterone therapy to mental health, because every man deserves to live his best life. Guys, so get comfortable, engage with us, and let's embark on this journey of knowledge, health, and empowerment. Your thoughts, questions, and experiences are what make this live stream a beacon of community learning and growth. Together, we're not just sharing information, we're transforming lives. So let's dive in. All right. Funny article, and not funny. Funny from my perspective sitting here. Just looking at some of the pharmacists' kind of pulse on mainstream media, right? So, probably to do males here that are sports fans, or, some females may kind of see what I'm kind of getting at here, but Aaron Rodgers recently just got kind of, hung out to dry in his rants against Jimmy Kimmel and whatever, but caught up within that was at least a slight towards Mr. Pfizer or Travis Kelce, right? So looking at that, it's caused us some interesting points to think about, and I'm surprised actually to see the pharmacy world actually reacting to it a little bit. And so looking at this coming out today from the associate editor of the Pharmacy Times, Ashley Gallagher. Celebrities do not persuade patients to get vaccinated. Pharmacists do. And this is awesome. That's all I gotta say. I'm gonna share you guys the article, because this, truly I think gives some food for thought there. And for those battling one way or another, who's the one actually out there performing the work? When you got Mr. Pfizer taking millions of dollars to go on and do his commercials, right? So let's read this. Despite Travis Kelce's recent commercial with Pfizer, data shows celebrity endorsements do not convince listeners to receive immunizations. The conversation about vaccination have only increased since COVID-19 pandemic. According to findings from a study in the Translational Behavioral Medicine, even though the COVID-19 vaccines have been proven effective, 55% of adults in the United States in 2021 expressed hesitancy because of effectiveness, adverse events, trust, policy, and expediency of production. These investigators said that misinformation could contribute to the public's perception of immunizations. Multi-component interventions could be effective at addressing vaccine hesitancy. The interventions include addressing specific populations, increasing knowledge and awareness, improving access and convenience, engaging community leaders, and addressing mistrust and misinformation. A recent ad by Pfizer tries to achieve all of these components, right? This is an article out of the Pharmacy Times today, guys. This is not Aaron Rodgers. This is a pharmacist perspective, right? A recent ad by Pfizer tries to achieve all these components. In the ad, Travis Kelce, and for the National Football League, NFL's Kansas City Chief, is seen going to a pharmacy to receive a vaccination for influenza when the pharmacist informs him that he can receive the updated COVID-19 vaccination as well. The ad tries to address those who are not vaccinated yet, use public figure to gain the trust of the audience while playing into a convenience of two vaccinations at once, as said in the ad. With Kelce's prominence in the NFL, an obvious choice to represent a pharmaceutical company and support vaccinations. However, in an interview with Pharmacy Times, Chris Morse, PhD professor and chair of the Department of Communications at Bryant University in Smithfield, Rhode Island, that Kelce will not convince patients to obtain a vaccination if they do not already plan to. If you're sitting there saying, I don't know whether I want to be vaccinated in the first place, I don't think even Taylor Swift could move patients who are on the fence, Morse said in an interview. But the bigger a fan you are of the celebrity, the more likely you are to say, all right, sure, Pfizer's okay. Although a celebrity endorsement is not enough to convince patients who are already resistant to immunization, it could convince patients who are going to receive a vaccination to choose a specific product. Celebrity endorsements in pharmaceuticals are not a new concept. For example, Khloe Kardashian, a reality television star, and Lady Gaga, a pop music star, have endorsed Rimegepant. That's the generic, or Nurtec ODT. We've seen all those, commercials, right? Whereas Serena Williams, a tennis player, has endorsed Ubrogepant, right? And these are these migraine medications, or Ubrelvy or AbbVie. Both medications indicated for management of migraine. Depending on the viewer, they may be drawn to a specific celebrity or product for their health conditions, thus inquiring about it at their pharmacy or physician's office. But products are not the only topic celebrities have endorsed. And we know in a different sense the, micro influencers on TikTok that just blew up on, Ozempic in 2023. But this is talking about the, big corporate mainstream agendas, right? And it's, again, pharmacists are out there actually doing the work. And I'm glad that we're putting some light on this. In 2022, talk show host Oprah Winfrey released a documentary about racial and health disparities in the healthcare system, intended to spread over the challenges encountered by racial and ethnic minority patients. Moore said that in cases of spreading awareness, celebrity endorsement can actually be beneficial. So, look at that, right? Celebrities are highly effective because their name brings recognition to a company or an organization that might not normally be able to get that. And with recognition, they have more sponsorship, bigger audience to talk about their product or issue, right? However, these types of endorsements do have drawbacks. Partnering with a celebrity can be risky, especially given cancel culture in the age of social media. For example, Kelce is prominently seen in the media because he's an NFL star, but also because he's Taylor Swift's current love interest. If the pair were to break up, Moore said, this would tarnish his reputation, thus negatively affecting his partnership with Pfizer, right? And, for those who think about it or not, it's like, things that are in the news and at least being pushed on that bigger end is just kind of worth considering, because how would that actually go if it would all happen tomorrow? But it's not, and so we're not in that point. But you never know. He could flip. You never know. Another drawback, also acknowledged, is the lack of qualifications and knowledge that celebrities have for pharmaceuticals, right? When celebrities endorse a product such as an athletic brand or a shoe brand, they can be seen as more trustworthy, especially if they're an athlete. Hence, Jordan, right? Celebrities do not tend to be qualified in information about pharmaceuticals or the healthcare space. And, Martha Stewart, Rob Gronkowski, Joe Rogan, no matter what. Joe Rogan, cool guy, smart guy, does a lot of research, but again, he needs a little bit of a different background in some of that approach there, because without specific, core foundational medical training, whether you're a pharmacist, nurse practitioner, any sort of medical provider, physician, there's just learn about therapeutic guidelines and the way things are run and the way things work, out there. So, to be a general thinker that hasn't really been in it is rough. So again, celebrities that start kind of tailoring towards that are the ones that really get tricky for you. But we know how it does. Kardashians, Rogan, right? Big ones, big ones. And so, what does this mean for pharmacists, guys? Pharmacists can play a critical role in helping patients learn and assess accurate information about vaccinations. Moore said that there are two main reasons individuals are hesitant about vaccines. First, their ability to find and receive the vaccination. Secondly, their questioning of the information provided for the vaccine. Celebrities can push patients to the pharmacy, Moore said, but they cannot answer questions that make the patients hesitant to receive a vaccination. A lot of times, patients don't have the tools to understand what's credible, what's not credible, or to weigh where they're getting their information from, right? What is the quality of that source of that information? In terms of pharmacists or medical professionals, one of the biggest things that they can do is address vaccine hesitancy is make themselves available for questions and make the patients feel like they're in an area where they can ask them, right? And that's the part that has been the negative feedback loop, because your big corporations, are cutting hours, have high demands, and pharmacists are not in a good position to answer these questions. And technicians can go so far in answering questions within the law, and then you start really kind of like teetering that. So again, in a pharmacy setting, I've given from 2021 to through flu season of this year, a little over 10,000 vaccines, guys, right here, this mono. And so you think about that, I might be, I'll give myself some really, I'll pad my stats there. I say I'm putting up some hella numbers, baby. I don't know if any pharmacist in the state of New Mexico gave as many vaccines as me in 2022. Oh God, right? So, anyways, minus that, I would just say who's actually there exactly, talking to the patient, regardless of who comes, nervous child, nervous adult, how many different questions come, and your former relationship when you give somebody a vaccine, it's absolutely insane. So again, Travis Kelce being the role, the figure there to try to show that and inspire that, sure, cool, but really, again, this is coming from a pharmacist who has a daily live stream, but I'm saying this is the kind of stuff that really needs to be, understood, is that it's funny how it all works when you got celebrities endorsing these things, whatever it may be. And of course, the Pfizer vaccine is a big controversial, eye-grabbing one. But, if something's hot in the media, who's getting all the calls about it? The pharmacy, right? Think about Prevagen or, some of these other big things, cannabis even to some degree, until it goes, federal and stuff, and you actually really have a model where pharmacies can all adopt, incorporating it. You're not going to see a lot of pharmacies fielding that, but that's my business model, right? So, when you do business with me, you're going to be talking to a pharmacist when it comes to medications, when it comes to cannabis and personalized care, all the way dialed in. That's how we live it, get it how you live it. So basically, moral of my rant is, when it comes to who you're talking to about medical questions, you're talking to your medical provider, you're talking to your pharmacist, you're talking to, other than that, you're watching the media, and, you're on the internet. And so connecting people with data and learning how to kind of, understand how that translates to when you're in your doctor's appointment, looking at your stuff or whatever it may be, right? Or just getting that vaccine. In this case, the pharmacist is going to teeter you over the line. Perfect one. Maybe you already made that decision to go get that vaccine, Travis Kelce, right? As this article was suggesting, maybe it makes you, if you're already prone to getting the vaccine, Travis Kelce can go remind you kind of to go get it maybe done sooner. right? But if you weren't going to get it, he's not going to change your mind in that commercial, right? So that's kind of what the article's getting at through the study. And so, as a pharmacist, how many times have you been, at the point of vaccination, and maybe you talked to the patient about their medical history, or you looked up their, state profile or whatever it may be, and they're indicated for, pneumonia shot, right? All adults over the age of 65. Right now, all adults over the age of 60 probably have not had the latest RSV vaccine, that new one that came out in May of this year. So, and that's one that could significantly be offered, at the time that you might get your regular conventional vaccines. Those back in the day, I remember back in 2014, 2015, we had our, I was working for Walmart. I was an intern. We had the pneumonia vaccine guidelines there. All adults over the age of 65. You got 2 pneumonia shots back in the day when you had the Prevnar 13 and the Pneumovax 23, and then you got a Pneumovax 23 if you were between the age of 18 and 64 with asthma, diabetes, certain other chronic health conditions if you were a smoker too. And so when I'm sitting there in inner city Albuquerque on Manal and Montebo, right, we were really able to get a lot of people to get their pneumonia vaccines on top of getting their flu shots. But I mean, profiling the smokers in the parking lot and things like that. As an intern, it was fun to talk to them. It wasn't like an insult. It was just like, how do you kind of get to know somebody and say, hey, we're here to take care of you right here. You probably got insurance, and we'll get you in and out. Boom. And, that's 2014 to 2018. Well, at least, my home store, Walmart on Manal and Montebo. And so we were jamming it all day long. So that's where Travis Kelce, cool stuff. Proud of you. Appreciate what you do. But ones who do the work are the medical providers, and it should not be forgotten, right? Regardless of what Pfizer does. Move on to the next segment. I'll be done ranting on this. Predictive analytics, guys. Predictive analytics help develop risk scores for hypoglycemia and more. This is a cool one from the Pharmacy Technology Report coming out of the Cleveland Clinic. So the Cleveland Clinic, and it was originally published, by the Specialty Pharmacy Continuum. But anyways, Cleveland Clinic used a predictive analytics model to develop risk scores that could be incorporated in pharmacists' clinical workflow. 4 factors such as 30-day readmission risk and risk for hypoglycemia, according to a session on predictive modeling to advance clinical practice at the ASHP 2023 mid-year clinical meeting and the exhibition held in Anaheim, California. So, interestingly enough, the first model was a 30-day readmission risk model trained against 6 months of institutional data. Explained Mark Wilner, PharmD, at the lead pharmacy informatics specialist at the Cleveland Clinic. He and his colleagues identified 20 variables with statistically significant readmission risk, and identified the top 5th percentile for pharmacist intervention, which included patients with a 40% or greater risk of being readmitted in 30 days. Guys, this is what I'm talking about. Like, okay, fine. I probably have seen the movie Moneyball back in my life, but I never really thought about the true meaning of it. So right now I'm currently listening to the audiobook of Moneyball, and this is the kind of thing in healthcare, right, that is going to change the world, where you're finding stats that are actually relevant to what's going on. And you're thinking about pharmacist time in the hospital, or all that kind of medical reconciliation and things. Guys, it's crazy to think what kind of stats you really could break it down to. So right here, patients with a 40% or greater risk of being readmitted in 30 days. It's cool to see that that's a interesting target point for pharmacists to intervene. For these patients, pharmacists were assigned to perform an admission, medication history, and reconciliation, and to help facilitate discharge MedRec. Some predictors of increased readmission risk included emergency department visits within the past 6 months, a number of visits, discharge disposition to home or home health, history of anemia, chronic kidney disease, chronic obstructive pulmonary disease, or substance use disorder, and number of inpatient medication disorders. Predictors of decreased remission risk included discharge disposition to hospice or a skilled nursing facility. Most recent, sodium and albumin result and observational status. Many of the variables identified by the predictive analytics model were unexpected and or not actionable, which caught the project team off guard. This required establishing trust in the predictive model, especially on the prescriber side. So again, either way, at first they were skeptical over time, but they found that the patient flagged as higher readmission risk did indeed come back more often. The clinical dashboard, got you right here, shows a patient's 30-day readmission risk as a numerical value along with the admission and expected discharge date. And whether the admission medication reconciliation and or discharge medication reconciliation was completed, this helps the pharmacist prioritize the patients that they need to see during their day-to-day clinical activities. So, as you look at things like that, it's very, very cool. So what else did they do? They also used predictive analytics to develop a hypoglycemia risk score that they incorporated into the pharmacist workflow. After identifying internally validated predictive factors such as age, glucose levels over time, and since admission, weight, estimated glomerular filtration rate, basal insulin dosing over patient weight, and active NPO or nothing by mouth status order, the team compared those factors with those obtained using already validated published model from Washington University School of Medicine in St. Louis. While there were some variables similar to the published scores, some additional factors came to surface that led to significant change in hypoglycemia risk. For example, older patients in the estimated glomerular filtration rate had an inverse relationship with risk. Unlike the readmission risk model, most of these were expected variables we did not pertain to hypoglycemia, diabetes, and insulin therapy. Interesting, right? So where you can make flags, flag patients, cross-examine certain data points for patients over one another and incorporate that into a pharmacist workflow, guys. Oh my gosh. So that's that's some next level stuff where we are really looking at the positive, things that are going to be happening with stats in healthcare. And, say we get a stat, right? Cool. We have our complete blood panel. Well, how does your complete blood panel, really cross with all of your, all of your other numbers, right? Age, height, weight, all your other factors that we could possibly get in there, and how can we really start forecasting some things and identifying some of those risky things that are happening, especially in our hospital, right? But that's a big place where you're going to really have that data to start looking at reassessing readmission risk. Diabetes and readmission risk is very, very big, on our healthcare spend, overall billions of dollars that we're spending, from our hospital systems just for that specific fact. And where pharmacies can really help prevent that, right? You're spending the most in the emergency situations, right? When shit goes really, really bad. And so, looking at that, how can you identify those situations from happening? You got to find those higher risk situations, put the right people in the right place to, make the right decisions and get the patient care coordinated. Boom, bada boom, bada boom. This is awesome. For sure. This is the kind of stuff that, hopefully starts spreading around even sooner than later, right? So I'm sure everybody's got variations of systems that they have in place, but when you're, predictive analytics like that is insane. All right, let's talk in enlightening now. CMS finalizing the rule to expand access to health information and improve the prior authorization process. So, this is pretty interesting. Wonder how it's going to affect healthcare. Multiple thoughts on this. First thought here is, well, I like the idea of the insurance having to respond to this within to prior, I believe, within 72 hours. So insurances have to respond to decisions there. So that means, those who are sending out the prior auth request to the insurance, whether it's from the pharmacy or the, doctor's office, right, or whatever administrative office it might be, those prior authorization requests have to be acknowledged by the insurance, within a specific capped time now, 72 hours. That's a good thing, maybe. So we're going to see how that kind of comes out, and hopefully some of that accountability there, helps these things get done faster. But, looking at this, it's trying to save about $15 billion, over 10 years, and maybe not, right? But what do we see? When a doctor says a patient needs a procedure, it's essential that it happens in a timely manner, says HHS Secretary Xavier Becerra. Too many Americans are left in waiting for approval from their insurance company. Today, the Biden-Harris administration is announcing strong action that will shorten these wait times by streamlining and better digitizing the approval process. CMS is committed to breaking down barriers in the healthcare system to make it easier for doctors and nurses to provide the care that they actually need to stay healthy. Now, it says CMS Administrator Chief Philip Brooks will assure increasing efficiency and enabling healthcare data to flow freely and securely between patients, providers, and payers, and streamlining the prior auth process supports better health outcomes and a better healthcare experience for all, right? And so, at least by 2026, payers will be required to send prior authorization decisions within 72 hours for urgent requests and 7 calendar days for standard non-urgent requests for medical items and services. For some payers, this time frame is new standard and cuts those decisions in about half. So looking at that, some people could be waiting 2 weeks for like prior auth decisions and stuff. And so that's, those of you who understand what the prior auth is and when you actually like need something that is truly most people shouldn't be able to afford, and that's understandable. So your insurance said you weren't supposed to be on it for whatever reason, and right then your insurance is supposed to give you an answer and try to get you to get it covered based on your provider's office sending labs and whatever other facts and justification that they have. So all interesting stuff. Let's see if this hopefully does help our healthcare system. Curious to see how it's going to affect every single kind of stakeholder involved. All right, let's move on to our Herbal Wellness Corner, guys, brought to you by High Horse Cannabis Company. All right, so for those of you guys who don't know of the butt cancer case study, guys, you can get RSO or Rick Simpson Oil. It's full spectrum extract cannabis oil at High Horse Cannabis Company, extracted by Botanics Extract, local extractor, local business, providing Rick Simpson protocol, about $2,400 worth of cannabis therapy for 60 cents for those patients with cancer. So looking at that, guys, how does that work? So if you have cancer and you qualify for the case study and you go, enroll through High Horse and all of us at the Trichome Alliance, the suggested RSO protocol, Rick Simpson Oil. Not going to go into the specifics about Rick Simpson or anything today. Canadian guy, engineer, created this oil for his cancer, which he cured himself. Definitely encourage looking it up. But the goal is to consume is 60 grams of Rick Simpson oil, generally about $40, $45 a gram, if you're actually going to buy it, over a 90-day period. This is a significant amount, so it's crucial to start low and go slow. We also recommend, if you're going to do it, to purchase a milligram scale for accurate dosing. You can actually measure exactly how many milligrams of FSO you're taking per day. So the suggested dosage outline: initial phase, gradually increase your dose until you reach 1 gram per day. Usually most people eat it. You can cook with it, but you can just eat it with like peanut butter, or you can cook with it, which sometimes it can kind of change that taste of food, and a lot of people don't necessarily love that. Maintenance phase: after you get the 1 gram per day, after 90 days, reduce to a maintenance dose of 1 to 2 grams per month, or 300 to 500 milligrams a week. Side effects there include sleepiness, sedation, increased heart rate, anxiety, dizziness, nausea, and difficulty with concentration. Guys, check right over here, shop High Horse. If you need to check around on the full spectrum oil there on the website, look around, call us, talk to us, message me, whatever you need. We'll get you taken care of. Other things there, you may have side effects there. Always good to consider having CBD on hand, straight up. CBD is probably the most effective cannabis, a THC, a reversal mechanism from going too hard, right? Those sorts of effects, psychoactive, that people do not want. Anyways, stop ranting. I know a lot of you guys have heard that from me, and it's all good. So, Community Spotlight. Welcome back, Aggies. The Department of Astronomy at NMSU hosting its first open house this semester at 7 p.m. this Friday. Join us at Clyde Tombaugh Observatory on Williams Street, just south of the parking lots and adjacent to the track. Bring your friends for a short presentation by Professor Chris Churchill, followed by the telescope observations with graduate assistants and staff. Looks pretty cool, guys. NMSU this Saturday. So that's pretty awesome, I think. There's the post for all of y'all who hadn't seen that. Last thing, in our Men's Health Minute, I want to give a good shout out to a local provider, guys, who, regenerative medicine, new thing, huge thing, important thing that we're talking about always. Providers to sit there and look at your labs, do primary care. Primary care is hard. Primary care takes a lot of time. We have a lot of people in the city of Las Cruces and the state of New Mexico who need healthcare. The provider to patient ratio is insane. And so, looking at always having, your primary care provider and then having your other secondary ancillary providers. Then in your Men's Health Minute, I highly, recommend Alpha Medical. They're here in town, they're local. They've got telehealth and in-health services, not only for hormone replacement therapy, but for also other wellness needs, and looking at your labs and getting that personalized, tailored care on top of, a complementary routine with your primary care. Really, really good idea. For our women, I really, really recommend Be Well Regenerative Medicine over in Mesilla. That place is awesome. But for the men, I'm pointing to this guy. These guys over here are great. So that's closing us up for the night. I hope everybody has a good rest of your